Hey everybody, welcome back to another reaction video. Today we're reacting to healthcare in the United Kingdom. This was posted by the YouTube channel Healthcare Triage. Like always, the original link to this video will be down below in the description. Also, I'm on the road to 1,000 subscribers, so if you like these reaction videos, make sure to hit that subscribe button. It'd be greatly appreciated. Now let's get into this video. So I, of course, heard many times from Europeans. They're the first to tell you how great healthcare is in Europe and terrible in America.
None of them are really socialized healthcare systems. To get at that, we need to go look at a system like that of the UK. More specifically, the National Health Service of England is the topic of this week's Healthcare Triage.
I'll give a lot of my comments at the end of the video instead of talking over it.
People like to throw around government-run healthcare as a phrase. Most of the time, it's a little hyperbolic. But in the case of England, it's actually pretty accurate. The National Health Service there provides care to everyone, all kinds of care. The system covers everyone who's ordinarily resident in the country. Basically, that means everyone except visitors and illegal immigrants.
Yeah, I wonder how true that is.
Receive free care in emergency departments and for certain infectious diseases. Coverage is pretty broad. Preventive services, inpatient care, outpatient care, physicians, drugs, dental care, mental health care, palliative care.
That's good. That's pretty good.
Long-term care.
No dentistry, though.
Some eye care. It's all covered. And it's pretty much free to citizens once they've paid taxes. Almost everything I mentioned just a few seconds ago has no cost sharing whatsoever, with the exception of dentistry and outpatient.
Yeah, why?
Drugs.
Why not dentistry?
The latter have a copay of just over £7.50. Inpatient drugs, on the other hand, are still free. And there are groups that are exempt even from outpatient drug copays. Kids under 16, no copays. Kids 16 to 18 who are still in school, no copays. If you're 60 or older, poor, pregnant, have had a baby in the last year, or have a number of chronic diseases, no copays. It turns out that only 6% of prescriptions actually incur the full copay in England. So out-of-pocket costs in England are really, really low. Public expenditures cover more than 80% of all healthcare spending. About 3/4 of that comes from general taxes, and most of the rest from a payroll tax. Over-the-counter drugs and other medical products account for another 10% or so of spending. The rest is mostly private hospital care for elective procedures. A lot of this is covered by voluntary health insurance, most of it part of an employer-based benefit system. So basically,
that's what America has, employer-based.
The population has private supplemental.
You could also just get your own without an employer.
Private insurers cover about 2/3 of all of those people. People are required to register with general practitioners, who deliver the vast majority of primary care. Most GPs work under a national contract with the government and are paid through capitated services, a bit of fee for service, and bonuses for good performance. But unlike most other countries, GPs actually work for the government, as do specialists. Almost all of them are salaried at hospitals run by the NHS. Patients have more of an ability to choose not only which hospitals they'd like to go to, but also which specialists they'd like to see in those hospitals than they have in the past. About half of specialists treat some private patients in private hospitals as well. Publicly owned hospitals are run by NHS trusts. They're paid for care at nationally negotiated diagnosis-related group rates, or DRG rates. Some care is purchased through the private sector, especially for mental health and elective care. Finally, the NHS pays for long-term care, although less today than it used to. Those who make less than £23,250 are entitled to free state-funded residential care. Most residential care is paid for by the private sector, though. End-of-life palliative care,
I have some thoughts about that.
Is provided by the NHS in hospices, homes, or even hospitals. What's great about the NHS? It's cheap. In 2011, England spent about 9.4% of GDP on healthcare, compared to the OECD average of 9.3% and the United States 17.7%. They spent $3,405 on healthcare per person, which is just above the OECD average. But that $3,405 is only 40% of the more than $8,500 per person spent in the US. The number of physicians per 1,000 population at 2.8 is lower than the OECD average of 3.2, but above the United States 2.5, which means they have more doctors than we do. They produce higher than average numbers of medical graduates as well. Life expectancy at birth is 81.1 years, above the OECD average. Mortality from cardiovascular disease is similarly better than average. Cancer mortality is below average, though it's worth acknowledging there have been better than average improvements in the last decade or so. Infant mortality rates are low, as are suicide rates. Diabetes prevalence is low in spite of the English diet. The percentage of adults who report being in good health is well above average. And they do this on a shoestring. Imagine if we in the United States spent 40% of what we do right now on healthcare, we'd have an extra like $1.6 trillion or more to play around with. We could massively increase spending on tons of other programs and still have a surplus. There are downsides. In order to keep spending so low, the NHS makes certain decisions other countries might find unpalatable. Some drugs are unavailable. Technology is nowhere near as prevalent as in other countries. Hospital beds are even scarcer than in the United States. Physicians and nurses work pretty hard. Hospitals aren't geared towards personal comfort and can be overcrowded, understaffed, and sometimes even dirty from what I hear. Waiting times can be longer than in other countries. And on many metrics of quality, the UK falls below where they would like to be. They're working to try to fix some of this. They've tried to increase patients' abilities to make choices. Providers are given more incentives to improve quality. Transparency and accountability are increasing. But as with almost all of these episodes, it's important to remember that Britain is a free and democratic nation. They chose the NHS, and they do so again and again. They love their healthcare system, and even elected officials from the Conservative Party support it. There are trade-offs to healthcare systems, as there are with so many things in medicine. It's easy to demonize socialized medicine for its shortcomings. We can't ignore its financial benefits, though. The NHS may not always be the best, but it certainly can lay claim to being efficient.
Alrighty, so that was an informative video. Still couldn't go through without mentioning the US in some way, but it is what it is. I mean, it was an American who was doing the commentary. Now, listen, I'm not going to say that the UK healthcare is bad and bash it. Obviously, we just saw right there that it's some good healthcare. We know that. We hear that all the time. But these European countries, a lot of countries have what seems, at least on paper, just sounds a lot better than what we have in the US. Now, I'll say this, as a employed person, my healthcare is fine. If I needed to go see my doctor, I can get an appointment this week. That easy. The problem I have, of course, with America is a specialist. If I want to see a dermatologist, it's going to take months. I scheduled an appointment a while ago for an allergist, and it was like a year until I got to see them. There's openings that happen throughout and before, but like my actual appointment, the earliest opening was like a year out, and that sucks. That does suck. But for my actual GP, I can get in this week. What I'm curious about is the population size. That's always just something on my mind. You know, America has 3 times the population, more than 3 times the population than all of these countries that do, the public health care, the free health care. I'm just curious, right? If America was to just switch in a week or a month, maybe even a year, because I know that something like this can't be an overnight thing, how would that work, right? 350 million people we got, so many more undocumented. How would that work? Taxes are going to go skyrocketing. I just don't know. Well, with the UK, let's say UK got 350 million people. Could they still handle that? It might take a while to adjust. I don't know. I'm just curious. I'm just asking. They mentioned that the UK has more doctors per 1,000 residents. That's actually pretty, interesting, because I know in America, medical school costs over $100,000. If you need to go to medical school, you got to take out a lot of loans. My fiance, she's a physician assistant, so she only spent 5 years in school, got her master's degree. Even she had to take over $100,000 in loans. Now she's making that back yearly, so she's going to pay it off pretty quick, just like doctors paid off pretty quick. But many people don't have that money right up front. If medical school was cheaper, we'd probably see a lot more doctors. Okay, that's just the facts. I know in the UK, going to medical school, I don't know if it's free, but it's definitely a lot cheaper. I know that. So that's just something to notice. We need more doctors in America, 100%. We need more specialists. Exactly, specialists. Like I said, it takes forever to get in to see a specialist. So I'd like to see more specialists in America. But, for people who have the health insurance, it's not that bad. Having private insurance through your employer, it's not bad at all. It's pretty good, actually. But of course, it's, it brings up the question, people who don't have jobs, don't have employers, you could argue, well, they can't just sit at home all day while we're working. There's definitely that argument, people on welfare who don't even want to bother. But then there's people who are working and, can't help it. They maybe their job doesn't offer health insurance. I completely understand. I'm in favor of exploring ways to get healthcare easier, because the healthcare system is a mess in America. I understand that. I won't deny that. Last thing I'll say, though, is there's a lot of things that we could do as Americans to help with this stuff, all right? Make it not as bad for us. Preventative healthcare, I'm such a big supporter of. Okay, we look at the food in America, it's garbage. The food that we're eating in America, so much fast food, so much chemicals, so much garbage in the grocery store. All these microplastics we're consuming, all these chemicals, it's just bad. Preventative healthcare, if people worked out more, drank more water, eat healthier food, we'd of course see, this healthcare problem, go away. Not completely, but it would get better. Okay, if people would just focus on preventative healthcare, focusing on their bodies. UK, of course, the food's more healthier. It's not as good as American food, but it's healthier, and it is what it is. That's why I'm sure that's definitely a big thing to look at. Preventative healthcare. Every American, everybody in the world should be focusing on first. That's the one thing you could do for yourself, is preventative healthcare. Eat healthier food, exercise, whether it's just take a couple walks around the block, whatever the case may be. Preventative healthcare, very important. But that's just my thoughts. Listen, UK has good healthcare. I'm not going to argue that. I have questions, and I'm curious about the long wait times, like people say. But we say long wait times are common with specialists anyway. So I don't know. Comment down below. I'm not trying to argue with anybody. It was an interesting video. I'm just curious to hear your thoughts. Once again, I'm on the road to 1,000 subscribers. So if you could subscribe, I'd be greatly appreciated of that. Make sure to comment, subscribe, like. I'm out, guys. Peace.